Everyone, welcome to my YouTube channel Nursing Education. My name is Pinky and today I'm here with one of the important topic, that is birth preparedness and complication readiness. So before moving to the main topic, please subscribe to my channel if you have not subscribed yet, and please press the bell icon to get more video. So birth preparedness and complication readiness is a component which focus on the antenatal care, and it is also the safe motherhood strategy which purpose is to promote the skilled birth attendance by helping women and their family plan for the pregnancy and childbirth, and which help in the reducing the maternal mortality. Birth plan or preparedness is an action that is developed by the woman and her family member with the help of the skilled healthcare worker to have a safe delivery and to be prepared in situation where the complication arise during the delivery and after the childbirth. So this is not a written document, like you are not giving woman to any formal document, but it is one of the ongoing discussion between the healthcare worker and the woman and her family to make sure that the woman and her baby will receive the appropriate care during the childbirth and will be able to handle the complication which may arise during the birth or after the birth. And this childbirth preparedness plan is usually given the woman during the first antenatal visit, but this will be reviewed and revised at every visit as the needed arises. And the birth preparedness plan is one of the arrangements which is made by the woman and her family with the help of the skilled care provider to be prepared during the childbirth. The aim of the birth preparedness is to assist the woman and their partner and the family to be adequately prepared for the childbirth by making the plan on how to respond if the complication arises, or how to respond if unexpected adverse event occur to the woman or to the baby at the time during the delivery and during the pregnancy or during the early postnatal period. National Protocol for Birth Preparedness and Complication Readiness. So this National Protocol for Birth Preparedness and Complication Readiness is for the Nepal National. So first one is to encourage all the pregnant women to have institutional or hospital delivery and to have delivery by the trained health care provider or a skilled health care worker. Second one is to introduce the concept of the birth plan on a second visit and reinforce it on the follow-up visit. So when you're meeting with the woman in the second visit, you have to discuss with the woman about the birth preparedness and complication readiness plan, and you have to tell why it is important. It is important to have a childbirth safely and to be prepared in the case of where the complication will arise. And this will be reinforced on the follow-up visit, and you have to ask or review or revise with the woman in the follow-up visit whether she is prepared for the childbirth or not. The third one is confirm the place of delivery and the provider with the pregnant woman and the family. So you have to discuss with the woman what is her preference of place of delivery, whether she has planned for the place of delivery or not. If she has planned for the place of delivery, then what is her preference of delivery, whether she want to have the delivery at hospital or nursing home or at home. If she has plan to have a delivery at home, then you have to encourage the woman to have the delivery at a hospital. And then also you have to discuss with the woman that what is her preference of healthcare provider, whether she want to have delivery by the doctor, by the midwifery, or by the nurse, or by the traditional birth attendants. Give information on how to recognize onset of labor and when to seek assistance, including danger sign in pregnancy and labor. So you have to give information to the woman on how to recognize the onset of labor. So you have to tell the woman that if she will have the contraction or tightening of the abdomen, or she will have the sow, it means that when the vaginal discharge will be like plug of mucus with a mix of the blood, and if she will have the backache, severe back pain, and if she will feel urge to go to the toilet, and also if she will have the water breaking or water leaking, it means that the labor has started and she has to recognize it, and you have to give the information related to the onset of labor. And we have to tell about the danger sign to the woman and seek to the medical help when she'll have the danger sign. And danger sign during the pregnancy and labor are the vaginal bleeding. You have to tell the woman to come to the hospital if she'll have the vaginal bleeding, if she'll have the severe headache, blurred vision, she feel convulsion or fit, if she'll have fever and feel too weak to get out of the bed, if she'll have the severe abdominal pain and she will feel the fast or difficulty breathing, anything unusual, anything abnormal, is abnormal than the usual, then she has to seek the medical assistance. She has to come to the hospital. And for institutional delivery, advise the pregnant woman and her husband or family about when to go to the hospital and take along the necessary thing. So you have to tell the woman or advise the woman that you have to come to the hospital when your labor will start, like when she has contraction and she will have the vaginal discharge of the mucus with the blood mix, and she will have the backache or water breaking or leakage. She has to come to the hospital and she has to take all the necessary things which she has asked to prepare during the antenatal period along with her. Arrange to have a second person of the woman one choice to be present and give support during delivery. So you have to tell the woman to arrange someone who can be present during delivery at hospital to take care of her and to support her. If the delivery is anticipated at home, in case of emergency, identify a skilled birth attendant. So there will be situation where she has to give birth at home in case of emergency. In that condition, you have to tell the woman to identify someone who is skilled to attend the birth. Inform pregnant woman about material required for clean and safe delivery. Also, if in case of emergency, if she has to give birth at home, you have to inform the woman about the material which she required for the clean and the safe delivery at home. Help her to identify her support people to take care of her children and her household. So also you have to tell the woman that if she's going to give the birth at home in emergency conditions, she has to identify someone who can support her, who can take care of her at home, and also who can take care of her children and her household. Arrange transportation to go to the health facility for the birth. So you have to ask the woman whether she's having her one vehicle or not. If she have one vehicle, then she can come to the hospital in any emergency condition or when the her labor will start. If she doesn't have one vehicle, then you have to give the contact number of ambulance nearby her, so she can contact to the ambulance during emergency or when her labor will start and come to the hospital by ambulance. And you have to also ask the woman to identify of a compatible blood donor of her. Suppose if she is a O positive blood group, then she can ask to the family member whether they are having a O positive blood group. If they have, then she has to make sure that whether they are ready to give blood to her in emergency condition. If they don't, if they are not ready to give, or if she doesn't have any family member of O positive blood group, then she has to contact to the Red Cross Society or the organization who is giving the blood. Then also you have to ask the woman to save some money for the childbirth and for the emergency expenses. Component of birth preparedness. So there are the around 8 components of birth preparedness, and I will talk about it one by one. So first component is decision making in an emergency. So this decision will be done at the antenatal period, and this decision will be discussed with the woman depending upon the woman condition the healthcare may need to recommend the birth in a specific level of healthcare facility, and this facility should have the staff, equipment, supplies and drug available to provide the best care. And if the woman is normal, there is no problem at the antenatal care and she is fine, then she can give birth at any healthcare facility where the birthing center is available. But in case if she's having some complication like pregnancy induced hypertension, diabetes mellitus, then she has to give the birth at a tertiary center where the medical person, doctor and the operation theater are available. Second one is skill attendant at birth. So the health workers should discuss the need for the skilled birth attendant. If possible, someone should be trained to ensure that the labor delivery progress normally and to manage the complication if they arise. So as a nurse or midwifery or health worker, you have to encourage the woman to give the birth at the hospital, and they're encouraging them to the home. Then third component is supplies needed for a clean delivery. So the hospital or healthcare facility will have all the supplies that needed for the delivery, and that will be the sterilized and clean. And we have to also discuss with the woman what she need to arrange and bring to the hospital during the delivery. You have to tell the woman to arrange some warm, clean and dry cloth for the baby to wrap and to the woman herself, and also you have to tell the woman to arrange some sanitary pad after the birth she may need. Fourth component is identify support people. So the woman has to identify support people, and she may need one companion to go with her to the hospital to take care of her at the hospital. And she may also need someone to be at her house to take care of her household, and if she's having children, then take care of her children. And she may also need someone to take decision for her during the delivery and during the childbirth. And she may also need some person to give her blood in the emergency of her blood group. Another component is established a financial plan for delivery. So the health workers should discuss the need to have money available for the things like saving costs for the motherhood. She may need additional food for the pregnant and for the postpartum period. She may need extra money for the medicine, for the treatment during the delivery, during the postpartum period, and she may also need money for the transportation to go to the healthcare facility. Saving costs for the normal delivery. So as a health worker, you have to assist the woman to save some extra money, to save some to make some extra saving of the food, extra saving of the money, and she can work some extra before being pregnant. And she can also talk to some reliable relative who can give the money in the emergency condition or during the delivery. Another component is blood donors. So health workers should ensure that the woman has identified an appropriate blood donor and that the person will be available in case of emergency. Next component is transportation. So you have to discuss with the woman about the transportation. If she's having one vehicle, then she can come to the hospital with that. But if she don't have the one vehicle, then you have to give the contact number of the ambulance which is nearby her, so that she can contact during the emergency or during the labor, when her labor will start, and then she can come by the ambulance. Important of birth preparedness. So first one is delay is a significant factor in many maternal and the newborn death and disability. So for example, if the woman has not prepared or has not arranged any transportation and some emergency occur, or the woman labor has start and she could not find any transportation, that may lead to the maternal and the newborn death and disability. And if she has not identified any person to give her blood, and also her blood group is rare, then it might make her difficult to get blood in the emergency condition, and then subsequently lead to the maternal and newborn death. Second one is birth preparedness ensure skill attendance and other factor that may contribute to the positive outcome. So if she has prepared for the birth, that ensure that she is going to have childbirth with a skill birth attendance, and that will be contribute to the positive outcome. Then complication readiness reduce the delay in if she has prepared for the complication and she has arranged everything, then and she know what when she has to go to the healthcare facility and what is the danger sign, what is the onset of labor, then she can recognize the problem and she can seek to the assistant by the healthcare profession, and then also she can decide when to seek care, and she can receive and reach the healthcare center and receive the care quickly if she has already prepared for all the for the birth, and she has made all the plan. Thank you for watching. Please like my video and subscribe to my channel. Press the bell icon to get more video. Thank you. Keep watching, keep supporting.